We are recording this session, as I just shared with you, for mostly documentation, but please let us know if you'd not like to be quoted or recorded, and we'll make sure we're able to accommodate that. I don't see any AI note takers, but in case you do spot one, please let me know and we'll be able to remove them. To save bandwidth, I'd request anyone who's not speaking to kindly turn off their cameras. Both Tanya and I are comfortable in speaking in Hindi as well as English. So in case if you have questions, please let us know either on chat or when you speak, and we'd be happy to translate them for everyone else. Use the chat window for any of your questions and comments. And as I'm moderating this in the last 30 minutes, we'd be able to also process them as they come. These are sessions that are parallel programmed. There's another session that's happening right next to it, and also two others that happen at 12 o'clock. I'll let you know about them as we close, but we'll have to keep to time a little bit. So yeah, that's mostly all the ground rules. CoreNet is a research community which was built starting May 2020, mostly with the intention to foster exchange and collaboration. And it's been emergent over the past few months. We've now got about 60 research practitioners or 60 organizations and about 200 individual researchers from across the country and the world that gather over Slack to exchange information and ideas. There's also a web repository, www.corenet.in, where you can find most of these studies and related documentation material. The community's been meeting over coffee hour sessions as well as public sessions called ethics dialogues. And really the intention of this conference was to bring everyone together to discuss what we've learned so far from the past year and where do we go from here. So without further ado, this is broadly the agenda for the session. We'll have EPoD share their findings from the study, and then we'll have some time for discussion. I'll quickly take a minute to introduce Tanya and EPoD, and then hand it over to Tanya. Tanya is a senior research associate at EPoD India at Krea University, where she works on Chhattisgarh-based studies that look at issues related to gender and the impact of COVID-19 on migrants. She works on the execution of the More Awaaz service as part of a study that aims to understand barriers to women's cell phone adoption and identify policy solutions to address it. She holds an MSc degree from Shiv Nadar University in economics and also a bachelor's degree from the University of Delhi. Also, a little bit about EPoD India. EPoD at Krea University works in collaboration with the Yale University Economic Growth Center and the Macmillan Center, and it draws upon economics, political science, and related fields to conduct research to understand how policy can promote inclusive, accountable economies and societies. Their core research focuses on gender as it relates to labor economics and broader economic empowerment, political economy and governance, as well as environmental economics. With that, I will now pass on to Tanya. Over to Tanya. Thank you.
So much, Rohan. So first of all, thank you to everyone for taking the time out. I'd like just to echo what Rohan mentioned earlier, that it's a terrible time right now, and I'm sure we are all, like, even if we are lucky to sort of not we've not had the chance to experience these things personally, it's a lot. So thank you so much for taking the time out and being here. So without any further ado, I'm just going to start sort of talking about our findings so that we have time for questions later. So we are in the midst of a second wave of coronavirus infections and another round of lockdowns, although these ones are relatively localized. And what we know from our previous experience is that there was large scale job loss. People were there was mass remigration that we witnessed, and social safety nets were stretched thin. We also know that this time around, things might not look exactly the same because policymakers have said that they intend to keep these lockdowns extremely localized and minimize the effects. However, we do think that said, there is the need for some long-term investment, longer-term measures to address related issues. So as we'll see, many who migrated back home last year never came back to work. They remained in rural areas, and then we'll also see that those who did migrate back, those who did sort of take that decision to come back to work, were not doing as well as they were. They were only starting to sort of, they were only starting to make up for their economic losses. So first, I do want to talk a little bit about how our work started and why we decided to do what we did. And the context for that is the first nationwide lockdown that was announced last year at the end of March. And this, for lakhs of people, meant job losses, uncertainty about food, uncertainty about their labor market prospects. And for migrants particularly, this meant going back home, and like the visuals that we saw, like in newspapers and the media, of thousands of people sort of making that journey back on foot, were doing so like at great personal expense and risk. And even once they were back home, it's not like the arduous journey was over. They were placed in quarantine centers. They faced a lot of stigma as carriers of disease and uncertain labor market prospects. So in this context, what we sort of wanted to do was we wanted to speak to migrants who from Chhattisgarh and Bihar who had returned back home in like the wake of this lockdown, and we also wanted to follow up with them at periodic intervals to understand how their experiences evolved. So we have a sample of about 4,000 migrants who we've spoken to over the phone, and about half of them are women. And we have spoken to them a total of 3 times so far. And the only sort of eligibility criteria for in which case we would speak to the migrant about their experiences was that they should not have been students and they should be above the age of 18. So this could have been someone who either migrated for work, like they migrated because they had a job outside of their home panchayat, or that they were accompanying someone who had a job outside their home panchayat. So if we can move on to the next slide, we can see, like, I do want to talk a little bit about the 3 times that we've spoken to migrants. So the first time that we spoke to migrants was in April of last year, like shortly after the lockdown. And our focus was on very sort of short-term immediate welfare measures like food security and their access to social safety nets. This was also a time when a lot of additional measures were announced by the central and state government. So we wanted to check what was the migrants' experience in terms of accessing these, and also whether they faced any stigma in like on returning to their home panchayats. The second time round, we spoke to them shortly after this, like in July of last year, and we focused a little bit more on how their households were doing, how their family members were doing, and their expectations for the labor market. So questions like, do you want to migrate back? And if not, why not? And if they had expressed an interest in going back, we asked them a little bit about what steps they'd taken to do, to like had they spoken to someone or applied for jobs, etc. And then we spoke to them a third time earlier this year, where we actually focused a little bit more on their social networks, both in their panchayats and at the place that they migrate to, and also about labor market discrimination. So we asked them questions about whether there was caste-based discrimination in terms of getting work, and also whether there was discrimination in terms of wages paid for work. At the moment, we are planning a fourth round of surveys. So the aim would be, like, I will speak about this in a bit as well, to understand a little bit more about how remigration decisions are taken, but we're still very much in the planning stages. Yes, so before I jump into like the findings from these surveys, I do want to talk a little bit about what our sample was like and what these people were like, so that we can have the appropriate sort of caveats in our mind before looking at the findings. So one thing that we do see, and you can see from the figure on the right, is that SC, ST, and OBC groups are overrepresented in our sample. So that means that a large percentage of them belong to these categories, these caste categories. Another thing was that most of them were engaged in non-agricultural labor or trade works, like they were like trade works like electricians or plumbers, or simply like non-agricultural manual labor. Another thing we see is that they were largely informal workers. Now, this is like a prior many of us might have had, and that's true. Over 95% of the sample did not have a formal contract in their pre-lockdown jobs. Another thing we see is that women in Bihar are significantly less likely to work. So on the figure on the left, you can see the very large orange section in the bar for Bihari women. And what that means is that that percentage of women, which is over 60, were actually not working themselves before the lockdown. They were accompanying someone who was working. So now this is not the case for all the other state gender groups, but this was the case for Bihari women. And another thing we see is that the nature of migration looks different in Bihar and Chhattisgarh. So like you can see on the figure on the right, for both men and women in Chhattisgarh, men like relatively less were likely to report that they worked only when they were outside their GP. So that meant that in Chhattisgarh, people generally worked both within and outside their panchayats, suggesting that their migration might have looked more seasonal, whereas in Bihar, migration probably looks more permanent in a sense. So this is like one state difference that we noticed. So the first finding that we see is that food insecurity has persisted months after these lockdowns. So we see that when we spoke to people earlier this year, they reported food security levels actually that looked very similar to those that were reported shortly after the lockdown. So food security is basically just to say that food security is very much still an issue. And if we move on to the next slide, we can actually see that what we wanted to check is, were government measures that addressed food security effective in doing so? And what we find is that basically, yes, they were. So we see that people who were not receiving any government transfers in terms of PDS rations were reporting much worse food security levels shortly after the lockdown in the first and the second rounds of surveys, which is like up to say August 2020, compared to those who were getting these transfers. And we can see that on the left side, we see the receipt of PDS rations by survey round, and we see that in the two rounds when people were actually getting PDS rations, even though the implementation wasn't perfect, it wasn't like a very large percentage of people were getting these rations. It was only about a little more than half. These were effective to a certain degree in ameliorating issues of food insecurity. And we see that in the third round, when these additional measures were no longer being given to people, we see that food insecurity security levels have somewhat, started looking very similar for these two groups. So this suggests that food insecurity was concentrated amongst those who were not receiving assistance, but also that these measures did go a long way in preventing suffering. So can we move on to the next slide, please? Thank you. So then we wanted to basically see who went back to work. And when we asked people questions about where they were in like earlier this year, we found that by March, slightly more than half of our sample had remigrated, and the rest remained in rural areas. And we do see that across these time periods, it's always women who are much less likely to remigrate back. Now, I do want to say that this is just a very, this is just a very summary statistics kind of figure, and we're definitely not sure if there is any sort of causation here, because women could perhaps be working different kinds of jobs. There could be different reasons that sort of affect their remigration decisions. And so we're definitely interested in sort of understanding more about why we see this. But then I, I, I just wanted to flag that this is something we do see, that women are not migrating back at the same rate. And another thing we see, like if we move on to the next figure, thank you, is that there is an occupational pattern in remigration. And what we see is that in the second round of surveys, which was July, August of last year, the people who had gone back were like, there weren't a lot of people who gone back, but the ones who had were largely machinery operators or involved in trade works like plumbing or they were electricians, or they had some specialized skill. And these were also people who reported that they were back at their pre-lockdown jobs. So not perhaps very surprisingly, the ones who migrated back earlier were those who had specialized skills and relatively more job security. And however, we see like when we spoke to them earlier this year, which was several months after the second time round, we see that those who are now outside of their home GPs are now largely manual laborers and non-agricultural laborers. And something we see across, like no matter when we speak to someone, is that if someone is back in their home GP, they're most likely to be involved in agriculture. Basically, early migrants were perhaps not very surprisingly those who felt they had more job security, those who had more specialized skills, and later sort of everyone, so later like others followed. Is kind of what we see in this data. So when we look at how well those who demigrated did, we see that they felt better. So they reported having jobs more often, they reported working more days, they reported larger wages naturally, and but even then we see that they did not reach their pre-pandemic levels of income. So for men, we see that on average, those who migrated back had reached about 90% of what they had reported as their pre-pandemic income, and women had reached 72%. So here too, women sort of lag behind relative to their male peers. And even when we look at those who remained at home, now they would, make a fraction of what they would have made pre-lockdown, because now they're in a different place. These are largely rural areas where they're at right now, but even here, women seem to lag behind. So the So what this suggests is that even those who had remigrated back were not doing great. They were only starting to sort of recover economically, and here too women have kind of not been able to fare as well. Okay, so for us, the next steps are basically to understand how, like, who remigrates, like what is the mechanism behind this decision to go back and to migrate again. So one set of factors that we think could affect this is basically like what job one does and how much money they used to make, and these are all basically, all of these contribute to your returns from migrating. So like, what is the value in migrating back? Another thing would be the socioeconomic resources to migrate. Like, can you afford to make this journey again? Do you like have social networks that could support you in this process? Are your employment networks strong enough? Like, is your previous employer either able to take you back or, you know, help you get a job? So all of these pre-existing characteristics of migrants will, like, these characteristics would also sort of affect their choice of whether they want to migrate or not. Then there's another set of factors, which is their subjective experiences of the pandemic and lockdown. So we could see a difference, say, if there's variation in how these lockdowns were implemented, and like, especially now since lockdowns are largely local decisions, and local labor market conditions and intra-household constraints. So how these shocks have affected them in different ways could actually be like impacting this decision as well. So we want to understand, like, to what extent do these different factors play, and like what is the mechanism of how this happens. And that's actually one of the advantages that we feel is about the design, which is that we talk to migrants periodically, so we really are able to sort of paint a picture of what happened and like how these different factors have come into play across time. Can we move to the next slide? So while we're still in the process, and we do want to like sort of talk to migrants again to understand how these things have happened, we do have some suggestive evidence for what might be taking place. And one of these things that we think might be at play is the relationship between their perception of discrimination at home and whether they want to migrate or not. So what that means is basically, as suggested by the figure on the right, is people who are more likely to think that there is discrimination, there is caste-based discrimination at home, are also more likely to migrate back. So and this also holds if this is also true if we look at the relationship between whether there is wage discrimination. So even those people who think that there is wage discrimination amongst different caste groups in their villages are more likely to migrate back. Again, like, this does confirm a prior many of us may have, but this is confirmed in the data. And another thing that we see, can we move to the next slide, please? Thank you. So another thing we see, which sort of explains a little bit, I mean, not explains, but suggests a potential explanation for the difference we see between men and women, is that women are much more likely to report reasons like domestic duties or household permission when they are explaining why they don't want to migrate back. So basically, we asked men and women about whether they wanted to migrate again. And if they said no, we asked them about why that was the case. And while women overall do report sort of being worried about more things, like we can see like all the bars for women are a little bit higher than the bars for men, but they are much more likely to report reasons that involve domestic duties or pregnancy, or the fact that the households that they don't have household permission to do this. So again, not a shock for many of us. We might have expected to see it, but we do, just to confirm that we do see this in the data, and that this is yeah, there is evidence for this. Okay, so the thing is, like, where do we go from here? As we find ourselves in another round of lockdowns, we basically, what we know is that those who did make the decision to remigrate and come back to work in urban centers were not doing as well as they were like before the first nationwide lockdown. And the need of the hour to address their welfare and to to ensure their welfare and ensure their well-being would be for localized lockdowns, as a lot of policymakers have already spoken about, and also providing access to food security during this time. And another thing would be to and perhaps, sorry, just to take a step back, perhaps providing these ration measures or like food security. Perhaps any kind of food security intervention could be sort of directed through employers in these urban centers if needed. Another thing would be to sort of not lose track of those who actually stayed back home and women, especially. So that sort of means that any measures of job, so measures of job creation or skilling, if they were to be targeted in rural areas, would be like quite beneficial to those who stayed back. And also, gender targeted programs could be very effective um, in addressing the sort of well-being of women who have, in a sense, either dropped out of the labor force or are finding themselves not doing as well as they were. So yeah, that is all I had. I'm happy to take any questions.
Great, thanks so much, Tanya. I have a few questions, but maybe I will wait for anyone else in the room. If they have a question, please feel free to unmute yourself, introduce yourself, and please ask.
Hi, this is Rishabh here from Quicksand. You're making a point about the caste discrimination and how that affects the migration. Is that caste discrimination at the location of their employment, or caste differentiation at the discrimination at the village?
So we asked about caste discrimination at the village. So we basically asked them if, if like people from, I think the phrase that I can't recall the phrase that we used, but we basically asked if people from backward castes and tribal groups were less likely to get jobs, and then we also asked if they were going to be paid lower wages. So we asked two things basically about caste discrimination in their home location.
Right. So the home location being where the village where they're from. So any reasons why? Why would sort of someone come back to discrimination rather than get away from it?
Oh, I'm sorry.
I mean, I thought the point was that the migrants are more likely to return to their home location if there is more discrimination in that location.
Oh, no, sorry. I meant to say that if they perceived more discrimination in their home panchayats, they were more likely to migrate back to work where they were initially.
Right. Okay, cool. Thank you for the clarification.
Great. I see we have a question from Shruti. Shruti, would you like to unmute yourself and ask your questions?
Sure.
Hi.
Absolutely.
Hello.
Hi.
Also, Shruti is a researcher based in Bombay, also an ex-member of the Coordinate Secretariat. So, over to Shruti.
Thank you, Rohan. It's really fantastic to see so many of you. And Tanya, that was really, really wonderful. I had a few questions about the outreach strategy that you used to, for respondents in Bihar and Chhattisgarh. How did you get in contact with them, or did they reach out to you? And, that's one. Did you go through any NGOs or place an ad? And then my second question was, was there any discussion on the types of food security programs that were accessed or their frequency? So I'll stop there and thank you.
Well, thank you for your question. So we did use government databases to sort of sample like the migrants that we wanted to speak to. So we had a list of the migrants who were returning back to these states that was provided to us by the state governments, and we basically selected a subset of this list and sort of reached out to them, and the ones that we were successful in reaching ended up being our respondents. About the measures that we asked about, we do have data on like whether they received regular PDS rations, which is exactly what their what they were guaranteed to receive according to their eligibility. Then we also asked them if they received any rations over and above this, so like extra rations. And then we also asked if they got any rations for free. So these three questions basically sort of allowed us to understand whether they were able to sort of access the additional ration, that were announced by the central government and also were announced by the Chhattisgarh government at the time. And I think also for a few months, the Chhattisgarh government was giving some rations for free last year. So a combination of these three questions would basically tell us which of these benefits were they receiving. And but we don't have like sort of more detail about this. And all of these three were about PDS.
Okay, thank you. And if there's time for just one follow-up, how did you identify the questions on food insecurity? Like which ones did you decide to ask and how did you come to that choice?
So we used a question on food insecurity where we basically asked, we kind of read out like one by one if they had skipped a meal, if they had gone an entire day without eating, and if they had if they're eating less than usual in the last 7 days, and like it was the last 7 days for both these things, and also if they're worried about food running out. And this was one question. And then another question was about whether we asked the same thing about not eating, but for the last 30 days. I think the question on where we had a recall period of the last 30 days was one that I think other surveys have also used, but the one where we had the recall period for 7 days was one that we designed ourselves.
Okay, thank you so much.
Great, thank you. Are there any other questions or comments? Anirudh, I see you've raised your hand. Please go ahead.
Hi. Thanks so much, Tanya. I think that was a super insightful presentation. So we're also working on, we did a survey like at the start of the pandemic with migrant workers as well. So this is like a topic that's super interesting and it's taken up most of my time in the past 6 months as well. But I just had a couple. So one of the things was to understand whether land ownership might be something that is potentially driving that decision. Because even in our survey, it seemed to be that the more so-called established sort of farmers who have access to wealth or who have to. I even noticed in your talk that you said about people who were working self-employed and they went back. So I was just wondering if there was any data on that. And I think the second thing is. On your pandemic-related reasons, like one of the things that we found in our study also is that it basically has to do with what they perceive to be the chance of contracting the infection. So, did you guys, by any chance, have any data on that, or did you manage to get any information on that?
Yeah, thank you so much for your question. And yes, like that's absolutely correct. We did ask about land ownership. We asked about basically how much land does their household own. I think we're still looking at the data for that, so we don't have anything at this moment that we can sort of see is like this is what we found. We do also ask. I'm sorry, what was your second question about?
Just on if there were any COVID-related. So when you mentioned the pandemic-related factors, like did you ask about maybe if they think that they're going to get COVID or if they already had COVID or something?
Yeah, we did ask about that, and I'm just trying to see if we could. So that was one of. We had a very large list of options that like they could have sort of told us about, and I'm trying to check if that gets covered in this figure. Yeah. So the first, if we can actually go back in the slideshow. Thank you. So I'm really sorry. But the first bar that we see for men and women, like that actually, that is like pandemic and other health reasons. So this would contain basically them saying something like the pandemic, which is generally like the pandemic is happening, I can't go back, or if they specifically say that I'm afraid of contracting the infection and I'm afraid of contracting the disease. So all of these we kind of collapsed into like one category, and the first bar in this is that.
Yeah, sounds good. And I think just wanted to say that the fact that females have sort of, or cite this pandemic, that's something that we found as well, actually. So that females sort of are a little bit more risk averse in that sense. So, but yeah, super interesting stuff. Thank you.
I had one question that I've left in the chat. Basically, this was about, I guess, once they've come back to the city, what is the likelihood? I mean, is there anything that we can say about their likelihood to move back in case there's another outbreak, right, as it is right now? And I'm guessing this is based on a whole bunch of factors, also around their trust, whether they've had this experience once. But if there were any questions you asked, or what's your sense about this?
So that's actually exactly what we want to get at in like the next time we talk to them, and that's exactly the question we want to answer as a result of this entire exercise. It's sort of what affects and what impacts this decision to migrate back, like to go back from home to like the place you were at before. And what we have data on so far is what they've already experienced. So this is one of the things that we're interested in sort of understanding, is that now that a very similar experience is sort of like a very similar things unfolding again, how would this sort of impact, like whether are they going back home this time or not? And yeah, like I really wish I had more to say, but like that's actually exactly what we want to look at.
I was just wondering when, this thing of when they moved from the city back to the village, did you find any insight on was social support other than sort of food security in their location of employment? Did that kind of influence them, how much of a reach that had and how much sort of support they got from NGOs and things like that in deciding when they came to back to their villages? And also when this decision of going back to the cities, was that also dependent on the kind of opportunities like Narega or anything else that was available to them?
Right. So yes, we did ask about other about other formal social safety nets as well. We asked about whether they had worked in Narega or any other government program that would give them the opportunity to work like manual labor. We also asked if they received other measures that had been announced at the time and measures that are usually in action, like pensions or the 500 rupee cash transfer to women. So we did ask about all of these sort of formal social safety nets, and we also asked in the most recent survey round that we did earlier this year about the size of their social networks. So we basically asked them, and we asked these questions for both places. Like we asked it about the village, and then also about where they were before the lockdown. We asked about how many sort of people did they know through professional networks, how many people would they say celebrate social events with, which gives us a sense of like their just social sort of networks of friends and like people they would socialize with. We also asked them about like how many people would help them financially if needed, how many people would help them find a job. So we do have data and we do have a sense of like what their social networks look like both at home, social networks in terms of like actual like socialization and also professional relations at home, and also like where they were at before the lockdown. So currently we're only sort of looking at sort of very raw correlations, and we do see that social networks for people who migrated out, like migrated back to urban centers, were actually larger. But we don't see a difference in like their social networks in these urban centers. We actually see a difference in their social networks in rural areas, but these differences are really small. So we're still in the process of kind of breaking it down, seeing, yeah, basically analyzing it a little more before we can sort of say anything conclusively.
Thank you.
Are there any other questions or comments or thoughts? Is anyone who's done similar work wants to share a reflection, if this resonates with anyone's own personal experiences? I was also curious about whether like there's any intention to also overlay some qualitative work on top of this, and yeah, I mean, whether it's on the pipeline, or how do you sort of correlate this with work that's being done by other organizations or other stories that you hear? Like, is there some way to triangulate this? And if so, like, what is it that you all do?
So that's actually like a great question. And so far, our approach has not been super qualitative. Like, of course, like within our formal sort of more quantitative surveys, we do always accommodate sort of responses that do not fit our options. Like in a more like sort of in an operational sense, like what we do sort of make the effort to do is that if someone is telling us something that is not accommodated in the survey, we still do note it down and it like exists in our data. Of course, like that, like it when we're synthesizing and when we're analyzing it, these things tend to sort of not come to the forefront because they are outliers in a sense. So while we do sort of what I'm trying to say is that while we do have the data, we have not really taken a very qualitative approach so far. Like we do, these are sort of the way it was thought of, was that these would be very quick, like frequent surveys where we like sort of are collecting this bit, sort of getting an understanding of their experiences in like snapshots across time. So far that has not allowed us to take a more sort of slower and qualitative approach to things. And yeah, like, and I think triangulating evidence is like something we should always be trying to do, but we don't have a plan for that yet. And right now, sort of our goal is to reach out to them. What we thought would be 1 year post a lockdown, but would now end up being in the middle of the second one. But we sort of want to understand where they are now in a similar way.
Tanya, one more question based on what you had shared earlier. So you mentioned that you got information about respondents from a government database, right? So were you or have you been able to take these results back to the government in any form? And how have they interacted with this information, if you have?
So yeah, we do share these findings with the government on a periodic basis. I I can't speak a lot to like what these discussions have been like, but we do sort of make an effort to share this with the government to sort of close the sort of feedback loop. And I think so. The sort of genesis of the Chhattisgarh end was at least exactly this, which is to sort of inform the government about what like migrants were going through.
Okay, and good luck as you continue to do that, because this is really important work that you guys are doing.
Any other questions? Maybe I have one more. And these are just coming because I'm also looking at your work, which says that you're also interested in barriers of women's cell phone adoption. There was one piece I spotted there, and also that you said most of your sample was SCs, STs, and OBCs. And whether there is, particularly when we talk about about women and phone surveys, we often end up saying that there is a massive degree of exclusion, etc. What has been your experience with that? And if you could speak to that a little bit, it'd be useful.
Yeah, absolutely. No, I think that's a great question, and do like please follow up with more questions if my response doesn't address what you had in mind. But okay, so to start with, like in the context of this study, to start with, we were given phone numbers. Like we had a phone number for everyone. That phone number was not always their own phone. It was sometimes the phone of someone like who was at the quarantine center with them. It was not even necessarily a family member. So something we sort of incorporated into the design of like how we call people, like our protocols for calling them, was that at any point we could take a new number and then start calling them on that. And this was particularly valuable because our sample was largely migrants who move around, and they could be changing phone numbers. The people they were around at any given point would be changing. And so what we basically do is that if we talk to someone and they're like, this person is no longer here, or they're like somewhere else, and we'll be like, okay, then give us another phone number, and then we make a call to that phone number, and this new phone number will then sort of get updated in like our data set. So we've kind of we have a system for updating phone numbers like in real time. This was particularly useful in reaching women. And another thing we do, because half of our sample was women, we prioritized reaching to women. That was a huge priority for us, was that we hired a large number of women enumerators. And we made sure that if we're calling a female migrant, if we're calling a woman up, that call is being made only by a woman enumerator. And that was very sort of valuable in terms of reaching the woman herself directly. So if someone else in her family picked up, they were much more confident in like sort of passing on the phone to her if it was a woman at the other end. So I think a combination of these two things, one sort of being able to change phone numbers and take new information, like basically call them at any number that they were happy to give us, and having women enumerators kind of helped us like survey women migrants really easily.
And was it incidental that their caste backgrounds happened to be the ones that were indexed, or like was that part of the criteria in your sample that you'd identified?
So so I'm less aware of like whether we stratified on caste at the Bihar side of things, but at the Chhattisgarh side of things, we did not stratify on caste. So this is like incidental. We stratified on gender, and we made sure that there was district representation. So what we sort of prioritize that we should be able to speak to experiences of women, and we should be able to speak to the sort of regional variation that we see within the state.
Great, thanks so much. We have a question from Anirudh.
Okay, so Anirudh, I think you've asked about whether we want to expand the sample to other states. So far, there are no plans for that, but that would be great. Like because right now, like I also said, like Chhattisgarh and Bihar are not exactly very similar. They're really different in many ways, and I think if having additional states would be a huge advantage in sort of speaking more generally to experiences of migrants. But so far, there are no plans for that.
Great. In case if there are no other questions, I would like to just take this opportunity to thank Tanya and EPoD again for doing this work, and then for sharing it with us. Thanks again to all of you for joining in and listening in. Thank you, Tanya. Thank you, everyone.